Matt, I can say with a high degree of certainty that sodium does not impact blood pressure long term.
That is a heavily controversial comment, and I'd love to delve into that. Today, we're talking all things sodium. Sodium, commonly known or most commonly used in table salt, being sodium chloride. We're talking about its influence on health, blood pressure, heart health, kidney health, its use in sport performance, and the impact of reduction or increasing it over that lifespan. Max, that's a loaded statement you just gone right there. Can we start off with discussing what is sodium as a whole?
Yeah, for sure. I've got a weird question for you. Can I ask that? I know this is a way out of whack.
No, absolutely, go for it.
Got nothing to do anything. But I think endorsing products is an interesting thing. We were kind of just talking about it before we started chatting, doing the podcast. And so I wanted to ask you, but I thought I'll wait till we're actually recording to see what your opinions are, because that's always more fun. If I was drinking, let's say I was really popular, let's say we had millions of subscribers, like PewDiePie or whatever, and I was drinking water, and it was, the alkaline water?
Sure, yeah.
Yeah. And I was drinking it, but I was actively saying, like, I do not promote this water. This water does nothing for you. It's dumb. It's literally just a scam, blah, 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 which it is, right? Is that still unethical? The fact that I'm still drinking it and inadvertently promoting it, despite me saying I don't support it?
Yeah, I try my best not to be associated in any way around products I don't support. Just because those companies can take you out and off context and put you on a clip. It's like, oh, like we're consumed by dietitians around the globe. Like, from a standard person walking across the street, they're not going to know who we are. They just know that we're dietitians in terms of like, hey, look, they're drinking my random product that has X whatever nutrient or special formula. Yeah, it's one of those things where even if I'm having a conversation or borderline a coffee with someone who sells Herbalife supplements, man, I am on a hawk's eye making sure nobody's phone's out taking a photo of me. I'll be very embarrassed to be even associated in the same room as those people. It's a scary time.
Yeah, because you're a lot more conservative than I am, and we've actually had discussions around that with my diet personally, because my diet isn't probably representative of what my diet in the past, I'd say, wasn't representative of what I would say we would necessarily recommend to our clients and what we think is probably optimal for health overall, because of the things I was having. And you told me just be aware that you're representing yourself and what that looks like to the public. And I thought that was an interesting point. And that's why this is kind of a different thing, right? Because you're actively saying, I don't support this. But, I was just saying, you can always have clips made up of your people might not listen to what you're saying. Actions speak louder than words.
They absolutely do. And it's one of those things of, if I'm recommending certain strategies to my clients, but I can't even follow themselves, man, I'm a shit dietitian then. I got to actually be able to incorporate them into my own life and work towards all these benefits. Because, of course, I know all the data. I know the reasons why I should be doing X, Y, Z and why I should be avoiding some other patterns. But if I'm not actually actively embracing it myself and I don't experience it myself, that's generally why I refer my bodybuilding clients over to you, Max, because I haven't gone through a bodybuilding prep myself. My kind of trajectory and management is more so of that long-term health management and the importance of muscle has on our health overall as a proxy for some other markers. It's an interesting area, absolutely. But again, practice what you preach as much as you can. Nobody's perfect. And that's generally what I preach as well.
No, it's such a, well, exactly. Yeah. And as do I. And I completely agree. And I think the biggest thing that I've found, and you might agree with me about the whole practices you preach, is that whilst it's, great in the sense that you can learn this amazing foundation of knowledge and you can have this wealth of experience, if you didn't practice what you preach, if we still know just as much as what we know, but you might not know things like how the person's might not be able to empathize with how they're feeling. You might just have learned in a textbook, this person feels sad when they're dieting. It's like, okay, but you haven't actually done it. You haven't actually experienced what it feels like, or you don't know small little intricacies of small little tips and tricks that you pick up along the way from doing it yourself. For example, like when you're losing weight, when you're dieting and you're really hungry, boy, you get really creative of ways to make yourself full. It's just that you have this need of, I need to feel full. How can I feel full? And suddenly your brain just starts ticking over of like, okay, I can eat this food and I can do it this way to make myself fuller for longer. And you don't learn those ways by a textbook. You learn by doing it. So that's why we're both massive supporters of practice what you preach. It's not a must. We have people we wildly respect that don't practice what they preach. Lecturers and teachers and all that.
That's a can of worms. Max, sodium is an interesting thing. I've always heard the kind of term electrolyte being thrown around. Man, that's a buzzword in itself. I think the whole Prime fad that came around was, oh, it's got so many electrolytes, that must be a good thing for me. It's just a fancy word for an ion. And specifically, the ions that we're looking at today is sodium. So sodium is a positively charged ion called a cation. It's important for nerve function, muscle contraction, fluid balance, ensuring that fluid stays where it needs to stay, ensuring that we have an adequate amount of it is really important, but too much can also tend to be, let's say, not so favorable. However, we'll get into that debate later on. When we're thinking about sodium overall, we're thinking of generally in salt form, in table salt form. That's sodium chloride. So that's one sodium atom with a chloride atom paired to each other. In terms of the weight distribution, it's 40% of that is sodium, 60% is chloride in terms of total weight. That's not really important, but it's interesting to know that if you're eating 1 gram of sodium, you're not eating 1 gram of salt. You're eating a lot more in terms of total amount of salt. So 40% of that being the sodium amount. Any comments on that one, Max?
Yeah. Look, this is good to know, and but it's not necessary. Just like what you prefaced it as, because at the end of the day, it doesn't really matter. What does matter is probably your ability to read the nutrition labels, read how much sodium things have in them, if you're concerned about it. And I guess that's what we're talking about today: whether you should or shouldn't be concerned about it, and to what extent you should be concerned about it if you are. But yeah, it doesn't really matter because, if you read something has 1,000 milligrams of sodium in it that you're going to consume, which is, 1 gram of sodium, obviously, you don't know how much 2 grams of salt is anyway. Like, no one is that precise with their weighing and their ability to pick up 2 grams of salt. So you're not actually able to contextualize it anyway. If I sprinkled it over my food and I was like, how much salt, how many grams of salt did I just put on? You'd have no idea. You might be able to take a rough guess, but you'd still have no idea. So it doesn't really matter in that sense. Does that make sense what I just said? Yeah.
It's the importance is potentially the change in behavior that we kind of exact from that. But it's important to note the milligrams of sodium versus the grams of salt, which is 2 separate factors. And talking about that, I find that Australians and Americans often compete of who is unhealthiest, which is hilarious to me. It's like, oh, Americans have higher obesity rates than Australians. Oh, look, realistically, they're pretty comparable. And I haven't kept up with the data in terms of what's going on and who's winning that race, if you can call that winning. But in terms of sodium, Americans, a standard daily intake is about 3,600 milligrams of sodium on a daily basis. Sorry, that's Australians. Australians are 3,600. Americans are 3,400, which meaning that they're a little bit lower, which is quite interesting despite the quote unquote highly processed nature of American diet or Western diets. That equates to around 9 grams of sodium for Australians. 9 grams of salt. See, I'm getting caught up in my own tongue. 9 grams of salt on a daily basis for Australians, or 8.5 grams per day for Americans. And that's a fair bit. And if you think about things, spreading that throughout the entire day, but often it's loaded a lot into 1 or 2 specific key meals. In terms of the general guidelines of what does that mean? That's just a number that we've approached and put on it. The World Health Organization generally recommends less than 2,000 milligrams. Australia is setting a target for 2,000 milligrams because they know realistically that we're not actually...
I thought it was 2.5.
Oh, 2.5? Sure. I was under the assumption it was 2,000. We know that realistically, if we recommend too low, the Australian public is just kind of going to think that we're silly and not actually listen to our targets at all. It's almost like saying, hey, we know the optimal way to avoid all of your heart disease and problems. You just got to eat a really high, heavily plant-based diet and include a wide variety of micronutrients and plants and minerals and also animal foods as well. But for majority of people, that's really difficult to adhere to. So we kind of balance it out. It's like, yeah, you can have some other things here and there. There's some give and take, but generally we're aiming for less than 2,000 milligrams. There's some argument that you're right in terms of what is the actual benefit to going lower. It seems like the benefit keeps increasing the lower we go, with exception to if you are metabolically active through exercise and activity, which is a whole separate argument. Max, thoughts?
No, yeah, you're 100% right about the 2,000. I think that one of the interesting things with sodium, and maybe I shouldn't say this right off the bat because, but anyway, is that it's not one of those things that you need to really focus on, in my opinion. And what I mean by that, it's a similar vein to vitamin C, in the sense that with sodium, you just need to focus on eating less processed foods and it will follow, in my opinion. It's just like, let's stay away from the foods that we probably want to be staying away from for long-term health outcomes anyway, and your sodium is going to come down naturally. And it's a similar sense with the vitamin C, in the sense that you don't need to focus specifically on eating foods with a lot of vitamin C in them. Just focus on eating more whole foods, whole fruits and vegetables, and the vitamin C will follow. And I see it in a similar vein, just on the opposite spectrum. I'm sure you're going to agree with me,
Max. It's almost like if you eat a whole food diet with a wide variety of colors and flavors and food sources, you're ticking a lot of boxes. That's insane, Max. I think you maybe have unlocked the secret to health and longevity right there.
Yeah. Like I guess what I'm getting at is that don't spend your time looking at, what I think would, if I saw a client doing this, if they were in a supermarket and they were going through all the different packets to figure out which one had the least sodium in it, my advice would be, let's not necessarily worry about that. Let's just get what you want to get from the packets and just reduce the amount we're having, or swap it out for something that's a whole food, rather than obsess over, I'm going to get this biscuit because it has only 200 milligrams of sodium rather than this biscuit has 300 milligrams. It's like, let's just get whatever biscuit you want, because we shouldn't be having that much of it anyway in reality. And let's focus more on the other foods. I feel like that might actually be a bit of a hot take.
No, I don't think so at all. I think that's,
really?
Yeah, I think that's generally the approach. Like, yes,
Really?
you can absolutely include foods that aren't, let's say, optimal for you. But if you're focusing on the foods that provide nutritional value to you, provide low energy density, provide other aspects that are beneficial towards your overall health, you're pretty much ticking majority of the boxes in that regard. But it's important to understand, well, okay, if we're aiming for low sodium stuff, why is sodium a problem? It's a problem from many different aspects. Humans are wired through general nature, including all other animals overall. I'm not familiar with any animal that doesn't like salt. Ask your cat if you're curious. In terms of disease risk, we're prone to it. In terms of just occurring in nature, it's quite rare. So of course, our brain tends to like the idea of something that is salty, something contains sodium, because of course it is an electrolyte. We sweat it out, we excrete it in our urine, we excrete it in our feces. We need to constantly replenish it on almost a daily basis. In terms of its impact on our health if it gets too high, previously when I mentioned its overall mechanisms and its impacts, the key point, which I think is really interesting, is its influence on osmosis and our ability to retain water and fluid. So the current thought process of how, and theory of how sodium causes damage in the body, is it raises blood pressure. How does it raise blood pressure? Let's say I've got an imaginary piece of your veins and arteries here. In terms of the sodium overall, where solute is, remember to check the link in the description or our website for our consultations. Back to it. Where sodium is, water will follow. So it's coming into our veins, and usually over an extended period of time, it elevates the amount of water in there, which elevates the blood pressure. Now, over time, blood pressure is a problem. Theoretically, not a problem at all. Generally, we find that there's very minimal influence of a high blood pressure spout, let's say when you're exercising, because of course blood pressure rises when you exercise. But in terms of the total benefit, we see a lot more when it comes down in blood pressure. In terms of its impact on kidney health overall, this is another aspect of it. Actually it negatively influences kidney health from a blood pressure aspect, but as well as potential the calcium influence. So I have to write this down because this is an interesting one in terms of the total calcium relationship. Sodium and calcium compete for the reabsorption. So sodium and calcium are both filtered by the kidneys, reabsorbed in the renal tubules. Where sodium is high, the kidneys prioritize excreting excess sodium to maintain electrolyte balance. This process reduces calcium reabsorption, causing more calcium to be excreted in the urine. So including on that one, it's not just the blood pressure aspect that we need to be worried about. The kidneys also take a toll, but additionally on top of that, our calcium intake, almost a calcium net balance, is reduced, leading to higher rates of osteoporosis and potentially some other factors that may not be associated positively for a reduction and a loss of calcium, especially if we're not having things that are containing calcium like dairy products.
Yeah, that's super well said, man, and really interesting and good. I think a really good foundational basis of knowledge to understand what sodium does, the role of sodium in the body, and all that as well. And we don't need much sodium, don't we, Matt? Do you remember off the top of your head how little sodium we need every day?
Oh, you're really testing me here. I'm going to guess around like 500.
Yeah, so the guidelines say 460. I'll double check it, but from memory they say 460 per day as an adult. I believe they say 460 to 920, and the reason why you alluded to it before was sweating. Sweat is variable, and it's not like one of those like a B12 or one of your other vitamins where it can be very consistent. You can have the exact same amount every day, and because we do actually excrete it via sweat, then it is something that will be variable each and every day.
Absolutely. In terms of going too low, sometimes this can happen. However, it's only in more of those multi-day exercise events where you've got your endurance athlete who is absolutely pumping it for literally like multiple hours at a time and sweating at extreme rates. Then maybe we might see some potential elevation for risk of cardiac events, because of course, sodium is really important along with potassium for contracting that muscle in an appropriate manner. With the reduction in total sodium intake, or more specifically, a reduction in available sodium around the body inside of our veins and our cells, we don't have the ability to contract and also reset, I guess, without a better term, those muscle fibers, so we can kind of keep pumping that blood around our body. But for majority of the population, I would say that you would never even come close to having a low sodium day unless you have something like postural orthostatic tachycardia syndrome or something similar to that, where you have a need for a higher blood pressure for separate hours out of the day from a quality of life perspective. But of course, that's a whole separate topic in terms of if the quality of life outweighs the pros or the cons related to that longevity aspect.
Mm-hmm. Yeah, and if you are doing any of those events, it's not something you probably need to be concerned about either. So if you're doing an endurance event or something where you're doing a cardiovascular event for a significant period of time, several hours on end, it's extremely likely that you're going to be using the gels anyway. It's just what people do nowadays, and people do it because it's pretty smart, and those gels contain electrolytes and sodium and everything you need in them anyway. So wouldn't be something you need to be concerned about. If you were doing those events anyway, you wouldn't need to be taking along a bag of salt with you and just downing salt as you run. There'll be plenty for you in the gels anyway.
I've found that some of my clients... Sorry, please go on, Max.
No, go.
I found some of my clients really like having salt chews. So to be like a stick of salt or something similar that's super salty, or it might be like a jerky or something like that on their runs. However, the evidence supporting it isn't really there. I'm more thinking that it's potentially a psychosomatic thing. And we all know how much the brain has an ability to influence our as perspective. Max, have I taken you through the caffeine experiment that we ran through in my sports nutrition course?
No. As someone who just bought a coffee machine today, please stay tuned. We're going to be speaking about caffeine a little bit over the next month or so, I'd say.
Will be. Max is a caffeine virgin, by the way, so we'll have a conversation about that. In terms of the influence on caffeine and sport, we all know that there's like a significant benefit to having caffeine and sport performance overall. It's an excitatory neuromodulator. It's one of those situations where, hey, there's no reason not to have it, but of course, acknowledging the gastrointestinal discomfort that you may experience and code browns, for lack of a better term.
With caffeine or coffee?
Caffeine specifically. Coffee is a potentially another factor overall, but caffeine specifically. So in the experiment, it was run by an individual at a university. I don't want to throw them under the bus because I'm not sure if it's public information, but they got a bunch of dietitian students and nutrition students. So these are people who are aware of nutrition and caffeine overall and how it influences the body and sport performance. They got them all to run for an hour at their maximum pace. I think it was all run or on a bike. And it was 3 separate times they gave them different dosages. They said, hey, this is a caffeine tablet. This is a placebo. We're telling you it's a placebo. This is the kind of the baseline for your neutral. They did the run. Cool. They had the experience. That's a baseline set. The next round, the same participants, they gave them the equivalent of 2 to 3 cups of coffee in a capsule form. For most people who have had coffee, 2 to 3 cups, that's a fair buzz. You're pretty pinging along the walls. That's something you experience. And they notice a significant increase in performance. I think it was like a 5 or 6%. I know I'm butchering these numbers, but it's around that kind of range in terms of total performance during that hour lot. Then they increased it a final time to the equivalent of like 5 to 6 to 7 cups of coffee in the equivalent of a capsule form. And they noticed their performance increased by like 15%, which is ridiculous. That's insane increase. Absolutely amazing. And then at the end of the kind of mock study that they did in the university, they come along and they stated, hey, we lied to you. The entire time they were all placebos. So that's the impact of psychology and how your mental state can improve and impact your performance with a known variable that we know the effects of, like caffeine. So it's one of those situations of, hey, don't discount your body's ability to respond to your mental status. And throughout my clinical placements in Melbourne's biggest hospitals, it was one of those times where I got drilled into me, hey, someone's mental state can directly influence their metabolic rate, directly influence their basal metabolic rate, their metabolism overall, and how much energy they need on a daily basis. So if they're wildly excitatory and stimulated throughout the day, whether through pain or some other means, it's one of those factors that you need to take into account, that your estimations are pretty much always going to be off, and you constantly need to adjust in terms of what your energy estimations are and how much energy they're actually required.
Yeah, look, it's interesting, but yeah, it's nothing new to us, which is just what we keep harping on about, and that how much placebo matters. You know, we always talk about that. Something that
absolutely
is,
even if you're aware if it's a placebo. Is that more of a controversial statement?
Yeah, I reckon. I don't know if I'd go that far.
Sure, absolutely. Max, you were jumping on before with some really great strategies for salt reduction. Do you want to take it away with your comments?
I think this is the last point we'll talk about before we actually get into practicalities. I think one of the really interesting things to discuss, and we've discussed this before as well, is that sodium is a really unique nutrient from a policy kind of government dietitian policy point of view, in the sense that it's the only nutrient, or the only micronutrient, where we have essentially lost the battle and conceded ground and just given up a target. Because with everything else, it's pretty hardcore. It's pretty hardcore of, boom, here's your RDI. I don't care what you think. Meet this. Do that. You know, it's very much black and white. I don't care about your emotions. Do this. Be quiet. Be a good boy. You know? Say yes, master. Whereas with the sodium, it's a bit of a different tune. It's a bit of a tune of like, well, look, we're going to give you what we think. 460 to 920 is our range of what we'd like you to have. But, you know, we'll also give you another target, which we think is more achievable and more realistic for you. And despite us not necessarily wanting you to do that, where we'd rather give you something that we think is more achievable rather than something that seems ridiculous, which is 460 milligrams a day, which is almost impossible in today's day and age.
Yeah, I think I don't even know how I would get through a day with kind of normal food products, unless I was literally just eating fruits, vegetables, and unsalted meat, which is, I think, a moral crime. I think if you unsalt your meat, it's one of those situations of, hey, we need to reevaluate your psych status. But in that same comment, I think there's a lot of things you can do realistically to get more towards that 2,000 and under on a daily basis.
Sure. And that's exactly why there's been that shift, you know, because if you're someone who is caring about it, you've got an interest in sodium and you want to try and reduce it, and you saw the number 460, I think there'd be a lot of people that would look at that, laugh, close the tab, and never think about it ever again. Whereas if I personally believe there'd be a lot of people that would see the 2,000 number, look at it and be like, wow, that's pretty hard, but I think I can actually do it or get close to it, you know? So I reckon it's a really good decision that they've made to ease the reins a little bit, be less strict, and give people something to shoot for rather than something that seems impossible.
I think, Max, it's really important to acknowledge the impact that sodium actually has on our daily lives in terms of, okay, cool. It's nice to put a number that, 2,000 milligrams. Yeah, cool. I'll try to get to that if I want to. But what is that actually doing to our overall life expectancy? China and more of those Asian countries have a very high sodium intake just from their overall culture and their food culture in general, with about 4,400 milligrams on a daily basis, or about 11 grams of salt from table salt or something similar. So it's often in sauces and things similar to that. The life expectancy lost due to high sodium diets in 2013 in China was 1.43 million deaths, accounting for 15.6% of all cause of deaths in that country. And that's wildly alarming to me. That's rivaling potentially some other factors that are really high in terms of like cancer and things like that. Because of course, that sodium intake has potentially massively contributed to influences of cardiovascular disease and major adverse cardiac events. To the point where cardiovascular disease, I had to write this down because we're not going to remember it all in my head. Prevention, a model study estimated that reducing daily salt intake by 1 gram could prevent approximately 9 million CVD events, including 4 million fatal events by 2030. So it's huge in terms of the amount of total life we could spare, and more importantly, the total amount of life that we can give in terms of the amount of years that we have on top of our already, let's say, finite lives. So it's one of those aspects of, okay, probably not going to have much of an impact on you at all up until the age of maybe 60. Once it starts getting to that point, in the same sense that weight tends to start to be much more of a factor, blood pressure much more of a factor, potential negligence for micronutrient intake much more of a factor on things like cancer risk and other disease. Kidneys tend to be much more of a factor when you get into diabetes. Once you get into that later year ranges from that 40, 50 onwards, the influence from your previous decisions for the past 50, 40 years really has an impact on your trajectory moving forward. And it's one of those aspects of that we really, really encourage, of setting amazing foundations and amazing positive habits over time that can lead you to success, rather than you thinking, man, I wish I just listened to Matt and Max when I was younger.
And look, it's not even that. I think you're even selling yourself short with that, is that, of course, these things matter as you get elderly, but you've harped on this before, and I think you're completely right, is that with sodium as well, and it's a big one, is that whilst you might see the repercussions when you're elderly, 60, 65 plus, they're because of what you were doing when you were 20s, 30s, 40s, and the reason why is because of what sodium does, what you were explaining before, high blood pressure. And that's exactly what we're going to be speaking about now, is the practicalities, what sodium actually does to you and what that looks like on a real person basis as to how it impacts your health and all that, sports performance and all that. Absolutely. Should we get stuck? I've got one question for you, but should we get stuck into that straight after that?
Sure. Hit me with the question.
All right. Well, look, I'm a person. This actually isn't for me, funnily enough. And most of my questions usually are for me. I'm a person, because I don't really care for salt that much. I don't know. It doesn't really do it for me. I like sweet stuff. I just don't like the salty stuff very much. And I love my salt. And the problem with salt is that, like, and it's similar to drugs, we were just talking about caffeine before, similar to lots of drugs, there does appear to be a pretty clear increase in the gradient of tolerance. Is that, a pinch of salt used to be plenty for you. It used to be nice and salty. And then as time goes on and the years go on, you start needing, 2 pinches, 3 pinches, whatever it is. And it goes more and more. Now, we know taste buds can change, and we know it takes a certain amount of time, 6 weeks or so. What would your recommendations be, Matt? If you got someone who's having a lot of salt in their diet and they really hate food without the salt, how are you going to go about helping them?
It's such an interesting question. And I was visiting a nephrologist, a kidney specialist, recently with one of my clients. And I had this question for him because I'm having some of my clients, and their blood pressure is just because of their salt, because they're consuming like 1,100 milligrams of sodium on a daily basis. It's insane.
1,100?
11,000. And it's one of those situations of how do we actually implement positive changes, especially when their habits are from the past 70 years of them having really high salt intakes. And it was a tricky scenario. I asked him and I posed a question: how much of an influence does something like a sodium reduced salt have on someone's life. So for people who aren't aware, there are different types of salts. There's magnesium salts, potassium salts. It's just a form of like a cation and an anion that's usually formed together, and that's I think that's what a salt is. The chemistry students are going to start yelling at me in the comments, but please do correct me. A sodium reduced salt replaces a lot of the sodium chloride with potassium chloride. Now, potassium chloride doesn't have nearly the same water attraction impact as sodium chloride does in our bloodstream. So having a higher potassium intake, our kidneys can kind of excrete that out reasonably fine, no problems at all, of course, unless you have kidney damage, but that's a separate story. Usually, kidneys can flush out all the potassium, no worries at all, but sodium is a bit of a difficult one for us to kind of manage without the excretion of a lot of other electrolytes and or molecules along the way. And reducing overall sodium intake is an important factor in that scenario. So I would absolutely, at the minimum, start with maybe a sodium reduced salt, just to see if we can have some positive impacts moving forward. And it might be of hey, it's only 40% reduction in sodium, but 40% reduction in sodium from 11,000 is a massive decrease. That's potentially going to extend years onto your life. And it's one of those things is, why wouldn't you give it a go? Thoughts and opinions, Max?
Yeah, no, for sure. We'll just quickly state, usually you're the one to do disclaimers, but I will do a really, really hardcore disclaimer right now. That was not medical advice or advice by any means. Playing around with your potassium is dangerous business. Doesn't matter who you are or doesn't matter how smart you are. Potassium is a dangerous micronutrient. And, Matt's just simply saying if there was an Earth on a different solar system, that could potentially be an option.
Yeah, absolutely. And that's probably why I'm so disapproving of Prime, in that it's got a ridiculous amount of electrolytes, more than your standard sports drink, which already has a lot, by the way. And it's not just the electrolytes that we actually need during sport, being that we lose majority of our sodium as the primary electrolyte that we generally lose. It's got a ridiculously high amount of potassium, which if you have impaired renal function or potentially some sensitivities with your heart, that's the thing that I'm really worried about. And that's usually why we're so concerned with potassium regulation in our patients with kidney disease, because it does lead to contractions and spasms of muscles. And side note, your heart is a muscle. That's the one thing that we want to keep working as much as possible. High potassium in your specifically your bloodstream can be really problematic. However, for myself, I can probably down 20 primes in a row and be perfectly fine, because my kidneys have an eGFR of over 90. Like, it's not something that I'm concerned about in the slightest. But for someone who has an eGFR of like, oh man, you're getting below 20s, I'm starting to get a little bit concerned.
Yeah, exactly. Yeah, for sure. And unfortunately, the reality is, unless you've had that checked, you also probably don't know, because symptoms for kidney damage aren't present unless your kidneys are extremely damaged. And so basically you're asymptomatic until you've lost, is it 90, 95% around that?
Yeah. When it starts to get to that kind of 85, 90% reduction in function, then, I'm feeling a bit strange. I don't know what's going on. And then they go, you take me and go to the hospital. And it's like, we're going to put you on hemodialysis right now.
And then you just feel a little bit bad. It's not even that bad. It's like, a bit off. Just going to go rest. So, okay, look, I like that. I always go for the spices route. If someone is looking to reduce their sodium, I always go for let's increase the amount of spices you're having, because that's a really good way to boost flavor into your meal without increasing the sodium, and it can kind of be a good swapper. But that's obviously that's such a typical thing of what I would say, because I'm always about swapping and all that. That's the name of the game for me. So, okay, that's great. Let's get into why sodium is bad. So, firstly, what does sodium do? It acutely increases blood pressure for your body. You explained that before. You gave a pretty thorough explanation. What does increased blood pressure mean for our health and all that, Matt?
Yeah, it's an interesting thing. So the overall blood pressure argument is that some people think it's perfectly fine. And yeah, acutely, in a very short time frame, perfectly fine. Majority of our body can deal with it, no worries. It's when we have a chronic long-term exposure to something like blood pressure, in the same sense that, hey, your atherosclerosis and your cardiovascular disease starts developing in your late teens. It's not like something that comes out of nowhere. We never saw this coming. He just had a random heart attack out of nowhere. Most of the time, it's been coming for a long time, in the sense that high blood pressure can really influence your overall vascular health over that extended period. It's just, if you would imagine a wave hitting a wall, you know, you've been to the beach before, Max, I assume, you out of that room sometimes. When you have a wave hitting kind of that sea wall, perfectly fine for, yeah, look, the day, it's not going to do any damage at all. But man, if you get a couple tsunamis in and you're really pounding that sea wall, eventually over time, it's going to wear down. And the same thing happens to our fine and delicate things throughout our body, being our eyes and our ability for our kidneys to stay healthy, and specifically the very small micro blood vessels that supply a lot of our body with really important nutrients. They start to get damaged over time. And of course, those things that get damaged over time, they don't heal as properly because the blood pressure doesn't really allow for that. And it's one of those tricky scenarios of, hey, unless we're providing some reduction in stress for it, even a small amount of time on a daily basis, it really does eat away at your ability to adapt from that situation.
Yeah. So I guess this is the whole catch-22 of sodium, in my opinion. And this is kind of what me and Matt would get at, is that, yes, sodium doesn't chronically, and when we say chronically, long term. So, you know, it doesn't raise your blood pressure for several months at a time after you ingest it. But the problem is that you don't eat once every several months. You eat 3, 4, 5, 6 times a day, which means that if each of those meals has a lot of sodium in it, you could essentially say sodium chronically increases your blood pressure. Because if you have your meal at 8 o'clock in the morning, 7 o'clock in the morning, by the time lunchtime comes around, maybe you're starting to get rid of the sodium you've consumed at breakfast. But guess what? You just had a ham sandwich with white bread and tuna. Boom. Back up. So it's like it was never low, right? You're just always topping yourself up with a bunch of sodium. And we're not saying that you need to have meals with 0 sodium in it, but the point is that whilst, yes, sodium itself does not, no issues. Matthew and I have got no issues if you have a bit of sodium, even a lot of sodium at a meal here and there. That's not concerning at all. But when it's a lot of sodium every single meal, so basically you're simulating a high blood pressure atmosphere 24/7 every day, that's when you start to run into issues.
Yeah, absolutely. And it's really interesting that you mentioned that, Max. You mentioned tuna, ham, and bread.
White bread.
All of those, I genuinely don't think that most people realize are really high sodium foods. And bread in particular, I remember going through my bachelor education. I flipped over, just curious around the food around my house. I'm like, whoa, it's like 400 milligrams per 100 grams. I'm like, this is ridiculously high compared to some other foods. And for context, generally per 100 grams, we're aiming for less than 140 milligrams per 100 grams to be classified as more of a low sodium product, which, just a heads up, for anything processed that has a nutrition label on it is really hard to get. There's not many products out there that, unless they're specifically designed to be low sodium, that have less than 140 milligrams.
Yeah. And this is kind of what, you know, we are kind of going a little bit full circle here as to why Matthew and I have come to the conclusions we've come to, is that because the reality is that we've got those guidelines of around 140, as Matthew was saying. It's kind of like, well, good luck finding something. You just can't. It just doesn't exist out there. So in Matthew and I's best opinion and our best call is that don't worry about, when you're buying something processed, don't worry about it. Just get it and eat it, and just try to eat less of it and eat more of the stuff that doesn't have the nutrition labels on it. Because the reality is those things are most likely going to be, you know, your fruits and vegetables and all that.
Quick ad break, guys. Remember to click the first link in the description to check out our dietitian consultations and services. Back to it.
Yeah, I love to focus on adding in. What can you add? You can only add so much before some other things that aren't working towards your goals start to get pushed out. Like I really focus on that as like, okay, I need to get my grains in. I need to get my fruit in. I need to get my veg. I need to get my protein sources in. I need to get my calcium sources in. Man, there's not much left to play around in the day, unless I'm like specifically looking to make like a high protein chocolate or something like that to try and bend the rules a little bit. It's one of those things of, hey, if you focus on the whole food that provide you with value, that provide you with health aspects, you're pretty much ticking a lot of boxes.
Yeah,
Max,
exactly.
In terms of the other strategies that I commonly have discussions with, I love your addition of spice. Things like adding acid or other flavors or spices in general. It doesn't have to be something physically spicy with capsaicin, or it can be things that are providing umami, or it can be things that are providing some other flavor aspects, which can be really beautiful. Herbs are a huge, huge benefit, as well as they're often very micronutrient dense, which I don't think people realize, especially with people just having a very broad assessment of your diet. Generally, people who have higher herb intake have higher health outcomes. I think that's more of a healthy observer effect, where people who have herbs generally are healthier in general. But again,
also
one of those
probably.
things to mention. Yeah, absolutely. 100%. But things like sodium reduced salt, rinsing your canned foods. Like if I have like beans and things, they put salt in the can to make sure that the beans kind of don't crumble under the situation of long-term storage. Because of course, if you have just straight water in your can, that's a very low salt solution. The sodium, the very small amount of sodium that is in the beans, is going to come out of the beans and kind of just make it all mushy. So they, of course, add salt to the packaged goods to make sure that it keeps on the shelf. So it's one of those things of, hey, rinsing your food can often decrease the amount of sodium a little bit, and not having that juice also contains some other things that may not be so favorable for you. So one of those things that are generally good. Aiming for those really non-processed whole foods, ticking off a lot of boxes, just really great stuff. And then no added salt claims may also be beneficial if you're looking to really kind of fine tune and like, look, I love having biscuits, that's not a problem at all. And if blood pressure is one of those things where you have to do every single thing in your favor, then maybe it's worth looking at that kind of situation. But that's probably bottom of the priority list in terms of where I'm sitting. Would you agree with that, Max?
Yeah, look, yeah, again, it's one of those ones. It's a bit of a gray area for me too. I'm in a similar boat. You know, if someone said to me, should I get the regular Vegemite or the salt reduced Vegemite? I'm going, well, like, look, do you notice much of a taste difference? No. I mean, just go for the salt reduced Vegemite.
Yeah.
I think the only thing for me, and what my concern would be, and I'd probably discuss this with the individual, because it's going to be very individual based, is I see this with people all the time when they have chips, such as your beetroot chips or your sweet potato chips or whatever it is, because they get disillusioned that it's healthier, less calories, whatever it is, it justifies them to eat more. So now it doesn't become a snack, it becomes a meal, or it becomes a big snack. And so now what unfortunately has happened was that we're having something that's virtually the same as potato chips anyway, but you've just had a whole lot more of it. Which is not good at all. So it's a similar vein with the Vegemite. We've really got to weigh it up here and take it on an individual basis. Is that how much less sodium is it? If it's not much, if it's more of a marketing claim than anything, then probably just go for the full one, because we don't like marketing, Matthew, don't we? And and two, what's the person's reaction going to be? Is it going to be, oh, cool, I'll have the exact same amount anyway. I only have 2 pieces of toast in the morning. Anyway, I only like a small sliver. So sure, I'll just get the salt reduced one. But if they go, oh, great, I'll get a salt reduced one. Now I can really lather it on. I can have 3 pieces instead of 2. It's like, I'd probably go for let's just stick to what we're doing now, because that's raising some alarm bells.
Yeah, pros and cons to every scenario. The pros have to outweigh the cons, and of course, including your mental load as well. Because if we're focusing so much on reducing salt, but we've completely forgotten all the other billions of different aspects that we can improve your health from other metrics, and you're focused so much on the salt that everything else just crumbles. Health is holistic. If we're talking just nutrition wise, we're not doing a good enough job, and I think that's such an interesting topic.
Oh no, 100%, and exactly, and you can look at what Matt's getting at is so true, and I think it could potentially frustrate people if you're listening, because it can seem like we're being really, really melodramatic here. Oh, what? People are going to get upset because they have to reach a bit more to grab the blue Vegemite that says salt reduced on it. That's such a big deal. It's like it actually is, yeah, because you have to think about it. And sure, that's one thing, which is not a big deal at all. But when you have to do that all day long, every single day, all the time, it adds up really quickly, and it becomes a really big deal. And something that is, we've got a friend, Matthew.
Yeah, he really likes you over there.
Guest number 2 has joined us. What are your thoughts?
Yeah.
So
that's a really important aspect of food noise in general, massive. Is that the decision-making process on a daily basis compared to what we used to do hundreds of years ago is ridiculously high. Like every choice that you make, it's countless amount more compared to what we previously was. Every swipe that you take, it's one of those situations of if you can reduce the food noise and focus on the most important things first, of course, that's what you should be doing. Choose the low-hanging fruit. Don't go for the really high one that's really difficult to get, but you're not really going to get much because it's a tiny little apple. Choose the one that's actually going to provide you the most bang for your buck. Sometimes that is salt-reduced products, and that's perfectly fine. But all I'm saying is that sometimes it's not. It's one of those situations where talking to a professional can really help you determine what is the most appropriate method of acquiring that health goal that you're looking for.
Yeah. And I think understanding some basic things, understanding that humans love, I don't see too many people that try to bite off more they can chew when they're starting out something. That just seems to be almost a blanket rule of humans love doing that. They love trying to do everything at once. And so if you can just understand that, hey, I'm potentially trying to do everything at once right now when I'm trying to change my entire diet at once, my entire lifestyle. I'm trying to start going to the gym, change all my nutrition, sleeping, everything is completely different, got a different job, all this sort of stuff. Realizing that let's just try and pull it back a little bit rather than push more is probably the way to go for longevity. Have you noticed the same things with your clients, Matthew?
Oh, absolutely. Especially with my masculine and male clients. It's those individuals who, hey, look, man, just tell me what to do and I'll do it. And then I'll kind of lean in a little bit more in that direction. And then they're great for like 4 or 5 sessions, then drop off the face of the earth. Then it's just too embarrassed to come see because I've had 2 days of drinking like 10 cans of beer in a day. And it's just, there's no coming back from it. Like, no, there's absolutely coming back from it. It's just, we've gone too far too quickly. And we need to reevaluate what our priority list is. That 1% per day perspective rather than that, I need 100% right now because that's how it's going to work. And that's how I'm going to get to my goals. It's look, you're going to see something quick, but you're also going to burn out way quicker.
Exactly. And if you make those small changes and it's not enough, you can always reevaluate down the line. 2 months later, 3 months later, you can reevaluate and go, oh, I actually could have pushed a bit harder and make some more changes. You can always do less and realize, oh, I could have pushed harder rather than the opposite and be in a pretty tricky spot because it's a tricky spot when you are burnt out like that. You know, it's kind of hard to navigate. That might be something we discuss actually, Matthew.
Yeah, that'd be great to discuss that whole yo-yoing effect. In terms of how that influences your dietary preferences, generally your taste buds regenerate every 10 to 14 days because, of course, the gastrointestinal system and all epithelial cells being your skin, your GI, your tongue, your mouth, all of that regenerates very quickly. It takes about 2 to 4 weeks for our brain to adjust to a new kind of sensory input. So, of course, it's a fair few repetitions of that taste bud regeneration as well as our brain kind of getting used to a new situation. So if you can stick out a slight reduction, not, of course, that it's your only thought every single day, but something that you may be uncomfortable 30% of the time, completely fine 30% of the time, and perfectly fine another 30%. If you can stick that out for about a month-ish, you're most likely going to be able to keep that up for a much longer term. But of course, that's very tricky because a lot of yo-yo diets last for about that month range and then it falls off massively. So it's very much a situation of nobody's brain is perfect and nobody's brain is exactly the same. You need to determine how long it takes for your taste preferences to adjust before it starts actually making zero difference on your daily life. And more importantly, the food noise that you have in your brain, how many decisions you have to make towards food. And is that something that is worth thinking about on a daily basis? So something to acknowledge along in that process.
Definitely. And that's why I like saying 6 weeks personally to my clients, because I think it gives a little bit of a buffer on that as well. And I would put it in the same vein as having sweet foods after meals. People, a super common thing that I get. I talk about that frequently, people having issues with because they feel like they always have to have a sweet food after a meal. And I say, let's just try and buckle down for 6 weeks, because I can nearly guarantee after 6 weeks of not doing it, they won't have those cravings and those issues anymore. It's
that's very interesting. I'd love to run that experiment on my clients who are willing, of course. I'm not going to randomly try to subject them to that, but that's something that I don't necessarily do all the time, but it may be really beneficial for some clients who are habitually trained to, of course, consume something sweet after their large meal.
Look, it's one of those ones that's tough because it's a bit more hardcore in the sense that, you know, the easier route would be like, oh, okay, let's have something sweet, but let's just make it a bit less, you know, maybe a piece of fruit or, you know, yogurt or something like that, which is going to be less intense. But yeah, sometimes I do go the hardcore route of like, okay, let's just buckle down for the next 6 weeks and see how we go. If that didn't work last time or whatever it is. And keeping in mind too, unfortunately, the way the human brain works is that once you do have those habits formed, it's also very easy to slip back for a lot of people. And you might notice that after 6 weeks you don't have those cravings anymore. You might be falsely disillusioned that you've beaten it, and that you might not realize how easy it is to slip back into your old habits.
And that's why it's so important to maintain and keep up with the same trajectory that you've been going with, because of course that's really powerful momentum, and ensuring that really heavy train keeps going and you don't have to stop and start is one of the huge factors of your success.
Exactly. Yeah. 100%. And yeah, I think you can definitely let your foot off the pedal with those things. You don't need to be as hardcore as like for example, in that first 6 weeks, you probably need to be pretty hardcore. It's like, no exceptions, nothing. I'm just going to be really, really tough on myself about this. And then after the 6 weeks, you can probably be a little bit less crazy, but there's always going to need to be that thing in the back of your head of like, am I slipping a little bit here? Do I need to tighten up a bit again? I think it'll always be there. If you've had a long history of these sorts of things, of sodium intake, sweet food after meals, all those triggers that people have, I think similar to any addiction, you never fully get over it.
For some people, absolutely.
I might be being dramatic.
It's good to check in on yourself and take care of yourself every now and then. Just check on how you're going.
Yeah. Do you reckon I'm being dramatic?
Sometimes. You're a bit of a dramatic person, but I think sometimes it's warranted as well. It's something to be aware of, that sometimes these factors can be. And then, of course, trying to be realistic with the situation as well, that sometimes these things are kind of creep up around the corner, especially in times of vulnerability. So it's one of those aspects.
Yeah. True.
If you have any questions on sodium, thank you so much for listening. You're an absolute gem. Comment below. We'd love to respond to you. We'd love to acknowledge your thoughts and your questions. Let us know what you think. Thanks, everyone. Bye-bye. Thank you so much for listening to the R.E.A.L Health and Nutrition podcast. The sponsor of today's show is you. You support the show by listening and using our services of dietitian consultations and performance coaching. We offer in-depth one-on-one consultations to help you achieve your health and performance goals. Any random bloke online can give you a generic meal plan, where we here at R.E.A.L work collaboratively with you to reach your goals, making you feel heard and including you in your journey's planning. Our service offers tailored advice and can accompany meal plans and/or realistic nutrition strategies, which can be booked via our website, www.recoveryexerciseandlifestyle.com. That's www.recoveryexerciseandlifestyle.com. Just a quick disclaimer, this podcast is for education, information, and general entertainment purposes only, and does not constitute the practice of medical nutrition therapy or healthcare of any discipline. The content discussed in this podcast is not intended to be a substitute of professional medical advice, diagnosis, or treatment. Please review our terms of use via our website. Thank you so much, everyone. Have a great day.